Petersen from Holtorf Medical Group joining us now on the show, and we're talking autoimmune disease.
And it's not mechanical.
No, but 23.5 million Americans are suffering from it right now. Can we define it first for our viewers?
Yeah, an autoimmune disease is when your immune system, its job is to recognize itself, your own body, and anything that isn't your own body it's supposed to attack. When it messes up and attacks your own body, that's an autoimmune disease.
Can I just throw a curveball at you? It's something that a lot of people say nowadays, oh, I've got an autoimmune disease situation. Is it just the way we're living?
Yes. Not just, but that's a huge part of it.
Yeah.
What happens, there's two things that are involved. Genetics and your environment. And so genetically, some of us have a predisposition to develop an autoimmune disease. Women have a greater propensity than men. Different races have greater propensities for different diseases.
Yeah.
But the environment part, yes, it's a lot of the way we're living. Some of it's infection, some of it's nutrition, some of it's pesticides, herbicides, heavy metals. All of those things are what tells your immune system, make an antibody. So you make the antibody, and then if you have a genetic predisposition for that antibody to attack your own tissue, now you've got an autoimmune disease.
Dr. Petersen, we just put some of those disorders up on the screen. Can you go through what falls under autoimmune disease?
There's a lot of things. The most common is thyroid, Hashimoto's and Graves'.
Okay.
The most probably recognized that people think about are joints, lupus and rheumatoid arthritis. There's a lot of skin autoimmune diseases.
I didn't know that celiac fell under that too.
And that's one that there are a lot of autoimmune diseases that may be somewhat ill-defined that are because of food sensitivities. We eat foods, they're good for us otherwise, but because our gut is inflamed, we absorb those foods undigested or partially undigested into the bloodstream, and we make an antibody, an IgG antibody, against a certain food, avocado. And now every time you eat avocado, you will have more fatigue. But it doesn't happen right away, and so it's not like an allergy. You don't really realize it.
What are you doing to help people out there to fix these issues?
I think the biggest thing is that we mess up when we just try to treat the symptom and to suppress the immune system. That's the typical treatment is, well, your immune system is acting too quickly or wreaking havoc on you. Let's give you an immunosuppressive drug. Well, that's not helpful because now you potentially are going to get sick, right? But that is the typical approach. What we should do is we should find the cause. Is it because of an environmental toxin? Is it because of a chronic underlying illness like Epstein-Barr? What is the cause? And let's treat that, and then you'll stop making the antibody.
We throw out numbers like 23.5 million. How many Utahns out there actually suffering and not knowing that they have an autoimmune disease?
That's a question I can't answer. I really don't know. I will say that it is super common as far as I see people. They come in, and we do some tests, and they've got autoantibodies.
So you're doing blood
Hashimoto's.
tests?
Yeah.
You're doing the blood tests?
Absolutely.
And tell me, when you do those blood tests, what is the next step? You analyze them? You're changing people's diets? What are you doing?
Yeah, you're changing people's diets. You're treating their illnesses, infections that they don't know they have. You have chronic Epstein-Barr. This actually, I think, applies to Utah, to answer your question. The University of Utah just had a breakthrough in research with regard to the genetic component in who gets sick, who feels sick and has symptoms when they get Lyme disease. I thought that was great that right here in Utah they're doing that study. Now, it's partly autoimmune. It's partly just genetics.
Yeah.
And so some people get really sick and other people don't have the same symptoms.
There's a gal on Housewives of New York that have Lyme disease. That's how I found out about it.
Thank you for tying that in. I think that fit great right there.
It did. That's how I found out about Lyme's disease. I wonder if I have that.
Of Utah, and we'll find
Exactly,
the wife here.
Dr. Petersen is one of the leading experts in the country about this. If you have questions, Holtorf Medical Group is the place to go. Their number on the bottom of your screen, and that's their website. We'll link you to it from ours. Go to 4utah.com. We'll have all that information right there. Thank you, Dr.
Thank you
Petersen.
so much.
Thank you. It's great to be with you guys.
Glenn and Emily, thank you very much.
All right, coming up in our next